When the COVID-19 pandemic first hit, hospitals across the United States discovered a critical structural vulnerability. In the middle of a global health emergency, we realized we had no domestic production capacity for the personal protective equipment required to keep medical staff safe. For decades, the U.S. had relied almost exclusively on just two countries, China and Malaysia, for its medical supply chain. When those nations halted exports to manage their own domestic crises, American healthcare providers were cut off from their primary sources. Frontline workers were left to improvise. Without a secure supply of N95 respirators, nurses were forced to rely on thin surgical masks or reuse single-use gear for days at a time. The collapse of this supply chain was viewed as a failure of national security. In response, federal officials vowed to permanently shift essential manufacturing back to American soil. To prevent a repeat of 2020, Washington launched an initiative to build a domestic PPE supply chain that could function independently of foreign trade. In Chillicothe, Ohio, a manufacturer named John Todoroki answered that call. He began the process of converting a 150-year-old paper mill into a medical manufacturing hub, capable of mass-producing nitrile gloves. Todoroki designed and built his own custom manufacturing equipment from scratch, positioning the facility to take on large-scale federal glove orders. The project was intended to be a dual success. It would provide economic stability for a historic Ohio town while securing the nation's medical independence. By 2026, the trajectory of the Chillicothe site has changed. Rather than growing as a manufacturing hub, the historic mill is now being prepared for conversion into a data center. The shift is being driven by a massive deficit. Todoroki reports that the facility is currently losing $5 million a month. These losses are not due to a lack of equipment. The production lines are ready to run, and the facility has the capacity to produce gloves at scale, but the factory currently lacks the volume of orders required to sustain itself. The site has only secured 2 federal contracts, one with the TSA and one with the Army. Together, these orders represent only a fraction of the volume Todoroki says he was promised at the start of the project. This suggests that the factory's struggle is not a failure of local manufacturing capability, but rather a gap in the actual procurement of American-made goods by the federal government. Chillicothe Councilman Richard McCourt recently went public with a detailed account of why those federal contracts never arrived in the volume expected. McCourt alleges that officials in Washington are declining to move contracts away from foreign suppliers in China and Malaysia because domestic production carries a slightly higher price tag. Beyond the missed contracts, the councilman raised a more serious claim regarding how some PPE is being labeled and sold. The allegation describes a specific method of supply chain fraud. Foreign-made gloves are physically mixed with U.S.-made gloves inside domestic packaging facilities. This mixed product is then sealed and sold under a USA-made label, masking that the majority of contents were produced overseas. If true, this allows the government to maintain the appearance of supporting domestic manufacturing while continuing to pay lower rates for foreign-sourced goods. Councilman McCourt has taken these claims to Ohio's representatives in Washington, seeking verification of the factory owner's account. Senator Bernie Moreno's office was initially involved in bringing the medical glove company to Chillicothe and has been tracking the progress of the facility. Moreno's staff investigated the allegations and informed local leaders that their findings confirmed the details regarding withheld contracts and the labeling of imported gloves. The verification by federal staff elevates these claims from a local business dispute to a documented issue of federal procurement mismanagement. The situation in Chillicothe serves as a case study for the broader national security goal the United States set after 2020. There is a paradox at play. The country has built the infrastructure to protect itself during a future crisis, yet that infrastructure is being allowed to fail in order to save on current procurement costs. Maintaining a national medical reserve requires more than just warehouse space. It requires a healthy manufacturing base that can surge production during an emergency. If the domestic manufacturing capacity built after the pandemic is lost to foreign competition today, the United States will return to the same reliance on overseas exports that failed to provide protection in 2020.